Good afternoon. Welcome to our media availability and live stream for this Friday afternoon. For those of you that might have missed it today, Prime Minister Trudeau announced a $100 million to improve access to food for Canadians facing social, economic, and health impacts of COVID-19. The funding is to go to national, regional, and local organizations across Canada to help support people and communities experiencing food insecurity. Some of these organizations would include food banks, Salvation Army, Second Harvest, Community Food Centres Canada, and the Breakfast Club of Canada, and then we'll work with our partners to meet the urgent food needs of Canadians, including, and importantly, the Indigenous peoples and northern populations as well. They'll be able to use those funds to buy or rent equipment, other materials to help address the unique needs of the community they serve and the health-related challenges presented by COVID-19. Social Service Relief Fund has been set by the Province of Ontario as well, and the City of Hamilton is to receive $6.8 million in the fiscal year 2020-2021. The first half of that sum will be received within the next couple of weeks, and it will go to our shelter system, our food security needs, and the addressing many of those significant needs right here in Hamilton that we've been working on, and certainly this additional money will help us do even more to deal with some of the marginalized community members in our community. As the Premier announced just a little while ago, and this is daunting, that potentially they are forecasting 3,000 to 15,000 possible deaths over the course of this COVID-19 outbreak. Thus far, the virus has killed 98 people so far in the province of Ontario. The number of deaths could be as low as 200 if people adhere to the restrictions that are being put in place right now. So I'm hoping that the community at large will continue to do the good work you're doing to maintain those restrictions. As well, I've asked our city bylaw and legal to prepare a bylaw that will allow our municipal law enforcement staff to enforce the physical separation requirements that have been put out by Public Health in the province of Ontario. For each offense, the fine will be about $500. And that bylaw will go to Council for approval this coming Wednesday at our Council meeting. And so we're putting more teeth into the requirement that you are to maintain separation at all times. I am a regular participant in the federal partners to ensure that we have ongoing dialogue with our Minister of Infrastructure and Communities, as well as the Deputy Prime Minister, on some of the fiscal challenges municipalities are facing. And as you might well realize, our revenues are down and our costs are increasing significantly right across the country. And the big city mayors had a conference call with Minister McKenna last night to talk about those very issues and how we're going to keep municipalities whole in this financial crunch that we're all experiencing municipally and individually in our community as people are out of work or out of jobs or looking to figure out how they're going to make the mortgage payment or deal with the rent payments. Similarly, the city has ongoing expenses increasing and revenues decreasing, and obviously we're offering up, as we announced a little while ago, a deferral of taxes for the penalties and interest that will basically offer those that need assistance to defer their taxes for a period of 60 days. And we would certainly ask those that can pay to continue to pay because the city needs cash flow, and then we're also desperately trying to ensure that we maintain employment as much as humanly possible, which is the major objective for the federal government. So we thank them for all of their work, and our ongoing dialogue between the federal and provincial government has been spectacular, and I know that will continue as we work our way through this crisis. The closures reminders are, again, the stairs are closed, the waterfall parking lots are closed, the beaches, play structures, a beach trail are all closed, not because we want to close them and cause you grief, but because we want you to stop congregating there and stop getting too close to one another and potentially spreading this virus to those that you don't want to spread it to. So very important that you adhere to those closures. Don't knock down the barriers. Don't step over them. Don't go around them. Stay home as much as humanly possible. If we all do that, we are going to be very successful in keeping the death count down. If we don't, then obviously we're going to have some challenges. At that note, I'm going to turn it over to Paul Johnson, the director of our Emergency Operations Center, doing a terrific job Many department heads, police, fire, paramedics, and all the emergent services are regularly, daily coming together to look at ways and means and how we're going to manage this crisis. And Paul has been leading that and is doing a terrific job. And I think he's going to update us on some reminders on changes that have already occurred.
Thanks very much, Mr. Mayor, and thanks for those kind words. Everybody is working hard, and more importantly, lots of city staff are out there working hard today, as they have been throughout this crisis, delivering not only the essential services that people first think about, fire and paramedic, our police services, our long-term care facilities, but many of our other staff are out there doing the things that we need to do to keep this city moving and to keep this city running. So garbage is being collected. Our transit system is operational. Our water systems, of course, are well underway. We're enforcing things, as some people are learning. To those that decided to golf yesterday, I understand they were visited by some of our police officers and issued a fine. That's an expensive round of golf, and it's a reminder that our golf courses are closed, even though they look very inviting this time of year. So one of the updates I wanted to bring was around HSR and our transit system. As you know, beginning today, we've instituted more changes in HSR to help improve physical distancing for those who use our transit system, and also the physical distancing from our drivers who are out there every day doing their job. And some of the changes impacted those with personal mobility devices. And today we've added an additional way of supporting those who need to travel without a companion and are in wheelchairs, scooters, or are CNIB card holders. So starting tomorrow, which is Saturday, DARTS will be providing bus stop to bus stop service. So this is different than our normal DARTS service, and so DARTS users who are using it under its normal circumstances, nothing has changed for you, essential trips, normal DARTS process. But for HSR customers who would not have a companion and need to use transit, we will be able to provide DARTS service booked for you, moving bus stop to bus stop. So it's not doorstop to doorstop, it's bus stop to bus stop. And this change will allow those who cannot travel with a companion to have an opportunity to use a form of transportation to get around town, specifically important for those who are working, needing to get to medical appointments, grocery shopping, and the like. So you will need to call DARTS at 905-529-1717. And you'll need to do that in advance, at least an hour before your desired departure time. But ideally, if you know you're going to work, you can do this up to 2 days in advance. And that would be a great way, particularly for those who are working, to ensure that everything will go smoothly. You'll need to identify that you're an HSR customer, as opposed to those who phone DARTS for DARTS transportation as a DARTS client. And you'll need to let them know the bus stops that you need to be picked up in your desired time and the bus stop that you're headed to. And for folks who are using the transit system regularly, all of this you'll know for sure. You'll wait at the bus stop for a DARTS vehicle to arrive, provide your name and show your CNIB card if applicable. And the DARTS driver will check that, and then you'll be able to board. So this is a great way that HSR, recognizing the challenge that this was going to face, quickly as we made some of these changes, layered on an additional amount of service for those who need our transit system. Just a reminder too, there's all this information will be on the web. It'll be on our HSR web pages as well, because it's a lot of detail here. So I encourage customers who are going to use this service to either call our customer contact, go online, or use other ways to get in touch with HSR, just so you're really clear about the process. But I'll also state here that you're booking one customer yourself per trip. A personal companion can come with you if that's necessary, but this is about your trip, not booking it for a group of people to go. So they'll take you through the process when you phone. I think it's a great partnership between HSR and DARTS. And just so everybody also understands, DARTS has additional COVID-19 precautions in place, so you'll be safe, and our operators of our DARTS vehicles will be safe through this as well. So it's a great opportunity, I think, for people to continue to use our transit system and recognize, like many of the other changes that have happened, these will only be in place for as long as we need them. And we recognize that some of them are actually very challenging for folks in the community, but we're doing it to keep everybody safe. We're doing it to keep those who deliver the service safe. And we're doing it, hopefully, for as short a period of time as this virus will allow. And the other piece is that we are out enforcing. And so I talked about those that were on the golf course. The police actually enforce that on, under the order, but our bylaw enforcement officers are out doing some of that work. And at times, public health may even be out doing some of that enforcement work as well. So across city employees, both our police services as well as the municipal employees, there is enforcement happening. We ask people to respect the closures that we've put in place, the changes that we've made, and recognize that removing the stuff that we've put up to indicate how people can keep safe is not only violating the provincial order, it's also criminal, and it could lead to a charge of mischief. So our signs and our blocks, barricades, and the things we've used to block off things are not there as a joke, or not there as something to be removed for your personal enjoyment. They're there for a purpose, and we'll take that very seriously if they continue to get moved and destroyed. So keep safe, everybody. Continue to use what is available. Continue to follow all of the recommendations we've heard. And today's announcement, as the mayor said, from the province, looking at what we can expect through what everybody's calling the surge period over the next number of weeks, really is an indication of why this social isolation, this social distancing is so critically important at this difficult time. And now I'll pass things over to Dr. Richardson.
Thanks, Paul. Thanks, Mr. Mayor. So today we have 138 confirmed cases, or that's 11 new cases over yesterday, and that's as of noon today. There are, of course, more details about the cases on the website, and you can find a lot of information there. But a couple of things just to highlight. As we've gone through the outbreak, you've heard me talk about how many cases we've had related to travel. And I just want to start looking at the latest cases that have been happening. And what we see in the cases in the last 10 days, 44% of them now are occurring due to community spread. Prior to that, overall, I should say, we had 24% were due to community acquisition. That means they have no link to an existing case or no link to travel. And now, in the last 10 days, we have 44% of cases. We're very glad to report that that backlog in the lab seems to have now moved its way through. As of last night, with all the cases that were coming in, it looked like they were all ones that had been tested in the last 3 to 5 days. So that's good news that that backlog has been, appears to have been cleared up. The other good news that is there is we now have 45 cases resolved. And again, just remember that for the majority of people who do get sick, this is a bad cold, it's a mild illness, but it is those people that are immunocompromised, those with chronic medical conditions, people who are over the age of 65, that we are most concerned about. And right now we're sitting at 22 people who are between 65 and 79 having cases, and 5 people who are over the age of 80. So it's really important, again, to look at self-isolation for those that are over 70 and for those who have an immunocompromised or a chronic medical condition, and to help each other out. You've heard a bit already today about the province's announcement around the COVID-19 modeling scenarios. Generally, it shows that our public health measures have been making a difference, a significant difference. As we go forward, we really need to make sure that we stay the course. It's important that we take it very seriously. The numbers that were presented today show what, different things can happen depending on what we all do and all do together. So while we're seeing we're having an impact, it is absolutely not meaning that it's time to let up. It is time to double down. We need to maintain the gains that we have made, and not just those, but continue to do even better. The situation that you're seeing today really represents what happened 10 days ago, because it takes that long for somebody to be exposed, to go on to get sick, to be tested, and then to get their results back. And so we need to remember that. We may look hopeful and may look at the numbers today and think, we're doing well, and we're doing better than we could be, but it's time to double down and continue to take this very seriously as we enter into what we're calling the surge period. The other thing, again, I will say is the piece about if you're symptomatic, stay home. And I'm going to say that over and over and over again because we continue to see it where individuals are going out and may not be thinking that what they have is actually COVID. They may think it's their allergies. They may think it's something else. But please, please, please stay home if you're feeling that way. You'll know soon enough if it's your allergies because it'll present in other ways. But please stay home. The other thing that we are seeing somewhat of is people maybe wanting to get out early if they have been staying home. And what we're asking for is 14 days of isolation if you're feeling those symptoms. That's the time period to make sure that virus has run its course. So to definitely be 14 days and to be getting significantly better, if not completely better, for the past 24 hours before you're venturing out. We know it's a long time. We know we've been in this a long time together, and it's going to take some time yet to do it together. But the actions that we all take will help not only ourselves, but everybody around us, and especially those that are most vulnerable in our community. That's it for me, Mr. Mayor.
Great, thank you, Doctor. And again, Public Health is doing amazing work, staying on top of these issues and making the appropriate recommendations, and we encourage you all to listen very, very careful to their recommendations. It's a matter of life and death for a lot of people. We've put a call out for personal protective equipment the other day, and I want to thank Cable 14 for making a donation of a couple of hundred gloves. No donation is too small, and no donation is too big. So let me also turn to thanking LIUNA, Laborers International Union of North America, who have made a very generous donation of 40,000 items of personal protective equipment, masks and gloves for frontline workers in long-term care homes. So thank you, Joseph Mancinelli and Laborers International Union, for that great contribution. And we continue to ask for surgical masks, N95 masks, impervious gowns, gloves, face shields, swabs, hand sanitizers, and a new ask today is for powered air purifying respirators. Anyone out there that might have that particular equipment and that you're not using it, it could be very, very well used in the front lines here and in our hospitals. And so if you have that, please call or email at ppe@hamilton.ca or call 905-546-2424, extension 2257, and make an appointment for us to be able to pick up the donation you're prepared to make. So thank you in advance, and please, anything that you have can be used on the front lines here. Some good news stories. Again, I mentioned Joe Mancinelli and Laborers International Union for their great contribution to frontline workers. Shout out to Shelley Falconer and the Art Gallery of Hamilton. Their art gallery is closed, but they're isolating themselves at home, but can enjoy the art gallery for anyone that is at home for the first ever online exhibition. It's called the AGH at Home. It can be found at the artgalleryofhamilton.com website. Shelley and their team have created an innovative way for you still to attend the gallery and get appreciation for the great art that's in the gallery. Currently, all of it done online. A big shout out as well to our local flower growers who have been donating flowers to long-term care homes and to the hospitals. Big shout out goes to Marco Zwan and CEO of Cohen Pack, and Sarah Fabioli, Prins of Prins Grow. They donated about 400 bouquet of flowers to correction workers at Hamilton Wentworth Detention Center on Barton Street. A big thank you goes out to them. And as usual, we're appreciative of the media continuing to share all of this information in the broader community. And we anticipate that we'll continue to work as partners to make sure that people get accurate and timely information. And beyond that, I want to thank our American Sign Language interpreter, Rosalie Vizers and Georgia Whalen, for their continued good work, sharing their translation for the deaf, and remind you that there is help for kids. If your kids or any kids out there that are challenged or having domestic issues or problems or mental health issues, call the Kids Help Phone or text at 686868 or 1-800-668-6868. There's help for you there at the kidshelpphone.ca, so dial in there. And for any adults that are having mental health issues as well in our community, reach out. There is help for you. You can call COAST at 905-972 8338 and get assistance right now. And as well, you can continue to make donations to blood.ca. They're still in demand. And so if you get on their website at blood.ca, they can give you a localized location where you can make that contribution. Again, thank you all for the good work that you're doing in the community. Most of you are doing what's needed to be done. These are very difficult times and very difficult challenges that we're facing. The numbers that are being thrown around, not only locally but provincially and national, are daunting. And if we do an effective job, we can minimize that. If we don't, then the worst can happen. And so it is in your hands. You are the ones that have to put this into effect. Everyone here is making great recommendations, as is the province and the federal government. In the absence of that, if you're not doing what we're asking you to do, then this virus will last longer than we want it to. So please adhere to what you're being asked to do. Thank you for what you're doing. It's hard on everybody, but if we can band together and support one another, be kind to one another, be patient out in the broader community. Getting things in the grocery stores are going to take a little longer when you go that once a week. But the reality is that everyone that's serving our community is doing the best they can to keep our city functional and safe. So thank you all for your good work, and I'll open it up to questions from the media now.
Thanks. I'll start by just reminding our media partners on the phone to please keep yourselves on mute. We'll go with one question and one follow-up. First is Dan Takama from the CBC. Go ahead, Dan.
Hi, everyone. Thanks for taking questions today. Dr. Richardson, we've heard a lot about these daunting or sobering numbers. I know that some other local health units, Windsor, for example, have spoken about kind of localized projections. They've broken it down that way. So have you received more of a localized projection from these provincial officials at all? And if so, can you kind of walk us through what that looks like?
Hi there. Thanks very much. We have only received the provincial numbers at this point. We haven't gotten any local numbers from the provincial modeling. We have had folks here in Hamilton, both people who are working with the hospitals and people working in public health, and people at McMaster, and some of our students, actually, our residents who work with us, looking at the modeling. And they are going to take a look at this data that the province has put out. These are all just really good models that are put together by mathematicians, and so they take a little bit of time to understand where we're each landing at. So we'll take a little bit of a look at these ones and look at perhaps how we could refine our models, and have more about that next week.
Okay. A part of this kind of update was a look at ICU capacity, right? And we've been, what it seems to show is that come about April 14, even the surge capacity could be overwhelmed. So we've been asking hospitals here locally to talk to us about what they're doing to prepare for the surge, but we haven't got a few details. So what can you tell us about what the surge capacity in Hamilton is going to look like and where it will be?
So in terms of the hospital measures that they're doing, the planning they're doing, I don't have details on that. I know they are working very hard on it. I know they're working at acute care beds, which means, beds for people who don't need to be in the ICU but do need to be in a hospital. I know they're working very hard at how can they help people stay in the community and be looked after in the community. I know they are working very hard on the ICUs, but I don't have anything in particular about the numbers of beds or where they are.
Thanks. Next question goes to Bobby from CBC Hamilton. Bobby, go ahead with your first question.
Thank you. I hope you're all doing well and staying safe. This question is for Mayor Eisenberger. You said revenues are down and costs are increasing significantly. Just how much money are we losing right now?
I don't have a number for you right now. I think that's something our finance folks are working on at the moment, but it's in the millions, I think, in terms of lost revenues for sure on a weekly basis. And expenses going up in the millions as well. So I can't put a number on it for you, but I know that our finance staff are working on that, and I'm sure within the next week or two, we'll be able to put a more definitive number around that.
I understand. And have you seen anything like this? Is this a first for financially in terms of the impact from this virus?
Yeah, I mean, this is the first time I've ever experienced anything like this. I mean, I think people kind of liking this to the Great Depression of the 1929 and 1930, where the whole economy collapsed, and there was a demand for infusion into the economy that wasn't done by the leaders at that point in time. So this decline in revenue and shutting a city down, shutting the country down, is obviously unprecedented. Has never happened in certainly my lifetime and anyone else's lifetime that's currently on the planet. And the adjustments that are needed to be made are pretty dramatic. And so when you look at the amounts of billions of dollars that the federal government is pouring into supporting the economy and individuals and businesses in the country, more on the way, I'm assured, and this is going to be multiple billions of dollars. And in the same token, the provincial governments stepping up, understanding that the supports are required in the community, in the homeless sector, in the cultural sector, just about every sector of the economy and of the city needs support, needs finances and additional resources. And fortunately, they're all stepping up. The big difference between now and the Great Depression is that governments of that day did not make a capital infusion into the economy, and literally the economy collapsed. I don't sense that's happening here. I think the governments are taking the right steps to support our country and our economy, and hopefully if we can curtail the length of this virus crisis, that will come out of this with a reasonable economy that we can step right back into and keep going. But I appreciate all the effort that's being put into this by both levels of government, and the coordination between all levels of government has been quite positive, quite dramatic, and quite effective, I think, and I know there's more to come.
Thank you very much.
Next question goes to Kevin Werner from Hamilton Community News. Kevin, go ahead with your first question.
Okay, thanks. The Ontario government has announced new closures, new restrictions starting tomorrow. Does this mean, and it's targeting the construction industry, does this mean that the city will stop issuing building permits?
So, Kevin, we'll have to look at all of the piece. I'm not sure it's a wholesale stop to building permits, and the whole piece about development applications, where this applies and what is stopping, as my understanding is it's new residential construction. So there still may be some other permitting work that's happening with things that continue. So we'll review that probably by tomorrow, have a much clearer answer. But again, I would stress at this point, no one should do anything without connecting with the building department, make sure their permits are in the right shape. And this doesn't stop the entire development application process, is my understanding. This is really about the construction that might be taking place in the short term. So we'll get a stronger answer as we review the impacts of these closures, and in particular, which construction projects are continuing and which construction projects are not.
Okay. And with regard to taking tougher measures, I mean, the province and Doug Ford seems to be willing to do anything, or at least everything's on the table. Will Hamilton do the same thing? I mean, especially if it's going to be a nice day, it's a nice day out now, and people are getting out. Will there be additional stepped-up measures to enforce people to stay home?
So we've certainly tipped into a situation where we are still trying to educate and where possible get people to comply. But I think what you're seeing in the past day or so, and we'll continue in talking about bylaw and the police, and even in public health, is that this is not a joke, and it's not a situation now where we're going to continue to come to these types of events and implore people to follow the rules. We now have the tools, and the mayor's talked about additional tools that the municipality will consider that are outside of the provincial orders, because right now we're only enforcing things that have come as a result of that provincial order. But there will be more things that we'll be enforcing. So, to say everything's on the table, I suppose the municipality's point is when we see repeated offenses, when we see people just choosing to willfully ignore the signs that have been put up and the closures that are in place, then we're going to take a fine approach to it and an enforcement approach. An example of that is if you're on the stairs, you're not going to be asked to leave the stairs, and on your way, there's going to be enforcement. Those are the types of things that are happening. It's pretty clear our golf courses are closed, so I'm not sure how anybody could confuse the fact they didn't pay a green fee. They didn't see anybody on in the starters area. So those types of things we're pretty close to zero tolerance on, Kevin. And as things continue to go, our enforcement will continue to ratchet up. As much as we can do as a municipality to send the message that this is serious, we will do. But in certain circumstances, it is about communicating with the public about why we're doing this as well. And so I also want to tell the stories, and we've been very happy that on occasion when we've had to interact, I would say it's mostly with businesses, and said to them, hey, you know, what's going on here is not in the spirit of what these orders are all about. They've been very quick to comply, and we really appreciate that. So that's what we're asking people to do. But I think we're getting to the point where a lot of conversation with folks is over. It's time now to start using some of the enforcement tools that we have at our disposal.
Okay, thanks.
Next question goes to Katrina Clark from the Hamilton Spectator. Katrina, go ahead with your first question.
Hi there, this question's for Dr. Richardson. I'm looking for any updates on cases at Heritage Green or at the Cardinal Retirement Residence in terms of staff and residents who have either tested positive or are showing symptoms.
Thanks very much. In terms of the two long-term care facilities, at this point, we have, the information I have is we have 5 cases from a long-term care home that are test positive. I'm just going to switch over, actually, Katrina, and just change my notes for 1 second, if you'll bear with me.
No problem.
We have as well, so we have the 2 homes that are involved. We are continuing to investigate in each of those. So the staff are, both the staff and the residents in those places are being tested in order to determine whether or not they have COVID-19. So each of those is still under review, and I don't think I have any new particular numbers for you. I think, you know, for us, Katrina, what's challenging sometimes is that numbers fluctuate over time, and you know, I think as we go through the process, I can tell you which of those have tested positive and are in long-term care, but to identify exactly who might have been identified as they go through, that's going to be a number that goes forward and our operational staff are going to be dealing with, and I'm not going to have accurately each day at this point.
Okay, so sorry, just to clarify, there's no new numbers?
I don't have anything new that I can share with you at this point.
Okay. And then my second question is, I'm wondering if you're hearing complaints from any either residents of Heritage Green, either at the nursing home side or the senior side, or from any of their family members about either lack of communication or lack of cleaning or anything related to that.
So when we work with any of these homes, we the model that the province has set up now is that their former inspectors are now advisors to the homes, and so when it comes to the actual operation of the homes, anything we hear that relates to that, we make their advisors aware of that they need to look at and follow up. So yes, those issues do come up during discussions. You know, this is a really difficult time for people who are both working and, of course, those living in long-term care and their families. And so concerns do arise about communication. They arise about staffing. They arise about, you know, what more can they do in terms of infection control. And so our team meets with them on a daily basis to talk about the infection control aspects and the case aspects. And then from a staffing perspective and the others, they're speaking with the ministry about those.
Okay, thank you.
Next question goes to Joanna from the Hamilton Spectator. Joanna, go ahead.
Hi, I was hoping, Mayor Eisenberger, if you could talk a bit more about that $500 fine that you're looking at imposing that was going to cancel this week. Can you talk a bit more about that?
Sure. It's not too complicated. It's a bylaw that will allow the municipal law enforcement to to enforce the physical distancing that we are requiring out there in the broader community. So they'll have the authority to issue fines if they believe that people are not adhering to that. We still hear instances of groups playing in the parks and doing a pickup game of football or a pickup game of basketball. All of that is contrary to physical separation, and so we want to make sure that there's an appropriate deterrence in place and that the municipal law enforcement have the appropriate tools to actually enforce what we're asking them to do. So that will go to council on Wednesday, and I suspect it'll be approved, and then the municipal law enforcement will have additional tools to enforce the physical separation.
Okay, great. Thank you. And Dr. Richardson, I just want to clarify from an earlier answer you gave. Hamilton's hospitals have not communicated with you or with public health regarding their plans to handle a surge in patients.
Oh, Joanna, no, I wouldn't want you to leave you with that impression at all in terms of communication that happens. There's absolutely communication that goes on between all of us in the health sector on a regular basis, and that happens both here in Hamilton and that happens across the broader Ontario West area as well. So we each have our role to play, though, when it comes to that work, and so they are doing a whole ton of work to work on creating spaces and getting up to speed and all of those sorts of things. And I don't have the detailed information that you're asking about. You know, our role primarily in that regard is to support them in doing our work in public health, which is around case and contact tracing, to make sure we're getting test results out quickly, to make sure that we're consulting with people around infection control issues and, you know, working on those angles when it comes to all of this piece. So it's not that we don't talk about these things, it's just that I don't have detailed knowledge of the work that they're doing.
And with that, I'll just check to see if there's anybody on the line that we didn't get to yet.
Yes, Tevye is here. I joined a little late.
Okay, Tevye, go ahead.
Thanks. I guess this is a question for Dr. Richardson. Dr. Richardson, we learned the other day about one person from the homeless community who had been tested positive. I'm just wondering if there are any more cases, either in the shelters or day centers or among the homeless community in general that we know about now.
Thanks, Tevye. Indeed, yes, we had the one case that was a homeless individual and, involved bringing them into the isolation shelter. We're not aware of any other cases at this point in time. It is really important to remember overall that the cases we have are the ones that have been tested and reported, and we do know that community spread is occurring. We're very, that population in particular is one that we're very concerned about in terms of cases and complications. So there are a lot of people working with them in the shelter system to support people, to identify people who are ill, to get them care from Shelter Health Network and other ones. But at this point, that is the only positive case that we're aware of.
Okay, thanks. And I think I'll just throw this question out to any of the three of you who wish to answer. Earlier today, we heard the provincial projections of 3,000 to 15,000 deaths. I think that's over a possible 2-year period, depending on how much we adhere to our various measures, from social distancing to washing our hands well. I'm just wondering what sort of reaction you had to when you heard those figures earlier today. It's stunning. You know what? That's all you can really kind of get to at this point. Is it surprising? I think we've been, knowing that it was going to get worse before it got better, but the degree to which this can get worse is daunting. I'm shocked and surprised. I'm worried, like most people are, and I think rightfully so. We should be worried, but we shouldn't be so worried that we don't act. And so we don't have the luxury of being analyzing and being paralyzed by that. We need to continue to act. We need to continue to step up. We need to continue to stay home. We need to continue to wash our hands frequently, and we can have a dramatic impact on those numbers.
But to suggest that, anyone might think that this isn't a dramatic, daunting quest that's in front of us, it certainly is. And you know what? I'd like to think that this community is up to the challenge of minimizing that. And I'm hoping that they'll continue to do what they're doing now. And I think most people are starting to realize that this is far more serious than they might have originally anticipated. And I think that message is finally hitting home. And again, I mean, at some point you're at a loss for words because this is such an unprecedented scenario. It is a bad movie getting worse. And 4 weeks ago, if you'd have said we'd be in this kind of a position right now, it would have been a laughing matter. And yet here we are in a whole new paradigm as a city, as a province, and as a country, as a world that is now kind of crippled by a virus that we're struggling to manage and hopefully minimize the impact of. And so I know we're tenacious and determined, and I know all of our staff are working equally hard to do the very, very best job possible for all concerned in our community so that we can minimize those numbers as much as humanly possible. That's got to be our mission right now, saving lives and protecting the health of anyone that has contacted the virus and preventing anyone from spreading this virus. So you go from being daunted and worried to action. And action is what we need. We need that action from our citizens. We need that action from public health and from our public works and our EOC team. Everyone has to come together to fight this virus and ensure that we minimize the impacts as much as humanly possible. I can't say enough about the work that our city staff and public health and frontline workers and public works and the garbage collectors and the folks that are out there keeping our city functional, the people working in the grocery stores. I happened to be at a grocery store this morning, and there was a person there that really went off. Either had mental health issues or was so frustrated, attacked one of the clerks in the grocery store just because he was frustrated that he didn't want to do the 6 foot separation. I know it's frustrating out there for people, but we cannot take these things out on the very people that are trying to help us get through this. And all of those people are on the front lines, the grocery clerks, the pharmacy staff that are maintaining the pharmacies at some risk to ensure that people get their medications, and everyone that's working throughout the city to maintain the roads and the sewers and the water and the garbage. All of that work continues, and they're all doing it because they know that the city needs to remain functional. So from a daunting number to action, that's where we need to be, and I'm sure that Paul and Dr. Elizabeth would have some thoughts on that as well, but I'm determined that we're going to minimize the impacts of this as much as humanly possible through the great efforts of this great team that we've got working here.
Thank you. I'll just check one more time if there's anyone else on the line who didn't get a chance for their question. With that, I'll pass it back to you, Mr. Mayor.
Thank you very much. And I want to remind our media, inform our media and Cable 14 that we will be changing our media availability in Town Hall next week. We will be doing the media availability at 3:30 on Monday and Friday, and we'll continue to do the Town Hall on Wednesday night at 7 o'clock. We will endeavor to bring in potentially someone from the Hamilton Health Sciences that might want to be here to speak to some of the questions that were raised here today about how they're making their preparations, and so we look forward to continue to do that. And we'll continue to share information as needed, as the week unfolds. Again, the website is on the screen. The coronavirus website for Hamilton.ca. All of the information you need, including federal and provincial announcements that have occurred, are all on the website. How to access funds that are being talked about in the federal sphere, and how to help your businesses locally. There is the investinhamilton.ca website that you can go to. All the information available in terms of the Hometown Hub and the online support that's happening for businesses in our community. So there are many, many resources out there for you to take advantage of. And beyond that, continue to do what you're doing, managing the difficulties and the frustrations, being patient with one another, being kind to one another, helping one another, help your friends, your neighbor, your family. Everyone's going to be challenged to get through this. If we can all do it together, we will be much more successful. So thank you for everything you're doing, and we will see you on Monday for the next media availability. Thank you.